All right, everybody, thanks for coming. So I am going to talk about public health. What is public health careers, what could you do if you were interested in public health for your future career, and how I made my way into public health. It wasn't a very direct route, but most people find themselves not making a direct route into public health. So I'm going to put all of that together. And in this first slide here, I had some pictures about what public health represents to me. These are my children. So public health is both personal and practical for my career and personal life. Here we have my kids. That's their cousin's horse. And if we could zoom in right there, this is my daughter eating while rubbing the horse, which of course I'm like horrified because I'm a microbiologist, but this is what children do. And here we have some other eating, hand washing, maybe sorts of incidences. And this is what I want to talk about because public health is population health. So when we're tasked with protecting population health, human, animal, or both, which is One Health, these are important things we have to think about, okay? So what is public health? This is a definition of public health from 1920, and it tells us that public health is the science and art of preventing disease, prolonging life, and promoting health. And then it talks about how we're going to do this. Organized efforts, informed choices of society, organizations, both public and private, communities and individuals. So we can all have an individual approach to our own health, our family's health, maybe our immediate community's health. When we're thinking about population health, we really need to involve community at large or society, government, federal, nonprofit. So we need to look at a wide range of what is important for community health or public health, okay? So the key components of public health then would be that they're population-based, so protecting the health of our entire population. And when we say population, that could be the population of our city, the population of our town, the population of our neighborhood, the state of Kansas, the United States, or the global populations. So when we're looking at large population-based strategies, we need to think about being prevention-focused. So when we have health, yes, we talk about medicine and treating a disease, but when we talk about public health, we want to be before the disease starts. What are we going to do in our daily life, in our family life, our community life to prevent and to think about prevention in terms of health, okay? So it's medicine is one area, population and public health is really taking a step back and looking at what can we do even before that, okay? All right, so this brings us to our concept of One Health, so public health and One Health. So when we talk about public health and One Health, we're looking at both the human aspect of public health, but also two other really important, the health of animals, because the lives of humans and animals are intricately linked. We are pretty much dependent upon animals for very many processes in human life, and also our environment, of course, to which we are inextricably linked. So One Health is this triad or triangle between these three great areas: environmental health or environmental science, human health, and then animal health. And how do these all fit together, okay, in terms of preventing and protecting our health. So this concept of One Health is certainly not a new one. It has been described many times and has very many names attributed to it, but our current understanding of One Health and how we see this globally is really looking at the entire spectrum of expertise with the goal of improving and protecting the health of humans, animals, and then our environment. And this would be for a worldwide format, okay? So some examples of what we would consider One Health. So in these images here, we can see right here would be our mosquito. And of course, mosquito-borne diseases are very important in terms of morbidity and mortality for humans and are responsible for the transmission of many diseases. So this would be a big area of import for our public health awareness. And of course, another picture of a child interacting with animals. So we see annually multiple cases of foodborne illness, and other gastrointestinal illnesses being transmitted between humans and animals. And those are zoonotic diseases, which we'll talk about in a little bit more. And then, of course, interaction with our environment, which is inevitable. So the idea of the health of our water, the health of our air quality, so all of those other environmental factors that we really have to think about when we're looking at prevention and population health. Okay? So why One Health? Why do we need to think about animal health plus human health plus our environment? Why can't we just focus on human health and let everything else just kind of come along? It's because they're all linked with each other, and as humans, we're constantly pushing our boundaries, and geographical boundaries are one of those. So we're constantly moving into new habitats. We're creating habitats for humans where there have not been habitats before, but we're also creating new habitats for animals. So when we think about destruction of our environment or moving humans into new environments, we also have to remember we're moving animals into new environments where agricultural animals have maybe not lived before. So we're continually exposing all animals, human and non-human, to new environments. So we have to be conscious of what are we going to find in that new environment. Is there going to be a different type of bacteria or fungal specimen in the soil? Are we going to be exposed to a new climate? What are we going to do to the water in that area? How are we going to impact the air quality? So we really have to think about all of these combined. And this is just an example of what we see in terms of how this is important. This is a weekly news alert from the United States Animal Health Association, and 2 of the 4 big topics that were being discussed was 1, prepare for disease outbreaks in livestock operations, discussing the importance of being prepared for a new disease and how you would plan for that. And secondly, another, and we'll talk about influenza a little bit more, warnings of the next flu pandemic. We're always conscious of what's happening with influenza on a global scale. Okay? So animal health and human health are definitely intertwined. Okay? This brings us to where we could find ourselves thinking about a career in public health. And this particular release was looking at workforce needs in veterinary medicine, and this was in 2012. And this looked at projections of needs in certain areas. And a few that they picked out were food animal medicine, veterinary expertise in industry, and veterinary expertise in academia. And one of the dual degrees that they focused on was right here, DVM MPH, and that is the Master's in Public Health combined with a veterinary degree. So we see the same thing echoed in estimates of public health employment needs. So the Association of Schools and Programs of Public Health, which is the national organization in the United States for public health education, that association estimates that there will be 250,000 additional public health workers needed in the next 3 to 5 years. So we definitely see an increased need for career professionals who have expertise and knowledge in public health for human and for animal. Okay. This is a picture of emerging diseases and re-emerging diseases. And the term, what we see here, emerging diseases, what are the new diseases coming out? What are diseases that humans and animals are being exposed to that we have not been exposed to before? Or what are diseases that are changing? Are there mutations, or are there changes in the vector that transmit the disease that makes us more susceptible to a disease that we have not seen in a particular part of the world? So we've seen this several times, Zika being the most current example of an emerging virus that has emerged over the last several years. Ebola, so if you think about last year and the year before, Ebola being increased in numbers, and then of course every year we see differences with influenza. So emerging and re-emerging diseases are very important for public health because we don't have to simply think about how to treat them. We also have to figure out what is causing them. Is this a new virus? Is this a new bacterial species? Do we need new medication? Do we have a vaccine? Where is it coming from? Is it waterborne? Is it from a mosquito? Is it from a tick? Is it foodborne? How are we going to even figure out how to prevent and stop? So an emerging disease brings in a lot of expertise from all different areas of public health. So in terms of veterinarians, medical doctors, nursing, and also social medicine, ethnographers, anthropologists, sociologists. How are we going to figure out how to discuss how to prevent this disease. So emerging diseases are very important to public health, okay? And this brings us to zoonotic diseases. So, zoonotic diseases are diseases that are transmitted from animals to humans. And currently it's estimated that at least 60% of all known pathogens are considered zoonotic diseases. So that means that humans are potentially exposed to many bacterial and viral pathogens that are coming from animals. A common vector, so the vector is the agent that transmits this disease to the susceptible human, could be a mosquito. It also could be a tick or another insect or another arachnid or any other agent that is going to transfer that disease from the animal host to the human host. And it also could be direct contact. Are we having direct contact with an animal that is infected with disease, or is there an environmental reservoir where both animals and humans can contact the disease? So zoonotic diseases are very important. I'm going to talk about a few of the big ones. There are many zoonotic diseases of concern and many important ones, but there are always a few that we pay attention to. One of the first ones is influenza. Influenza is a disease that's caused by the influenza virus, and I'm sure we're all very familiar with it, and hopefully you all had your flu shot this year. So influenza is a very important disease. In the United States alone, about over 30,000 people die from influenza every year. We see a lot of older people and young babies and young children being the primary groups that are affected by influenza in terms of morbidity and mortality. And we're very concerned with what is happening in influenza globally. Is the virus changing? Is the virus mutating? How is the virus different from what it was last year? Is this the same virus that we found multiple years ago? How are we going to think about expanding our surveillance and our testing and our prevention of this virus? So we're continually working on influenza and trying to figure out how we will combat it. Okay. So in the United States, we have many things to be concerned about. 5 to 20%, and this is just the human population, gets influenza every year. This is not counting all our other animals that are susceptible to influenza, avian species, when we think about our chicken population, pigs, cats, dogs, horses. So many of our animals are susceptible to influenza. More than 200,000 people every year are hospitalized from complications. One of the major complications would be pneumonia. So a lot of elderly people have complications with influenza that then contributes to their illness. Again, another large area that we're concerned with are children. About 10% of the hospitalizations are children younger than 5 years, and the majority of hospitalization, again, occur in adults older than 65. So susceptible people that we need to be concerned with during influenza season. Okay. An unusual case of influenza that happened in this current influenza cycle right before Christmas. Some of you may remember it because it was considered very unusual, and it still is unusual, that there was an outbreak of influenza type A, which was a circulating virus at the time. It was considered an avian influenza type A, which means that virus strain originally came from an avian or a bird species, okay? And there was an outbreak amongst cats in an animal shelter in New York City, and this happened in December, so right before Christmas. The CDC did confirm that one human who was a veterinarian who was treating the animals also contracted the virus from the cats, and the veterinarian was working with and looking after all of these cats and did have prolonged, unprotected interaction with the animals, so they would have been exposed to secretions from the cats. The veterinarian survived, so they had a mild respiratory case of influenza. And perhaps if we had not known the cats had influenza, the human in this story may just have thought he had a serious cold, okay, because he really had a mild case. This is not the first case of this type of situation. There has been 3 total infections in humans with this particular type of influenza. So it's not unique, but it's certainly different and something we need to be taking care of. Another interesting story with influenza is in bats. Influenza A virus is found in bats, and this has been found in several countries. We first saw it in Guatemala in 2009 and 2010, and influenza virus in bats have been seen in other countries in Central and South America. The species of bats that we find the virus in is not native to the continental United States, but is native to Central and South America. So this is another thing that we're concerned about. Bats do not respect geographical and state boundaries, and as the expansion of bats and other possible vectors like mosquitoes, as their range expands, so does the disease that they carry. So when we're thinking about our environment, an important thing that we usually discuss in terms of where mosquitoes are, where bats are, and where birds are is climate change. So as temperature changes, the range of animals also changes, and that brings diseases closer to us than we haven't had before. Okay. Another one of interest would be prions. Excuse me. So prions are proteinaceous infectious agents. And in this country, we're concerned with two prion diseases. One of them would be chronic wasting disease. We find chronic wasting disease in deer and elk. This is a news story from the end of March where 70 deer were euthanized at a farm in the United States. It was in Iowa, in Hazleton. So we're concerned with CWD spreading between deer and elk populations. And there are prion diseases of other animals. There are prion diseases of cattle, which is BSE, bovine spongiform encephalopathy, which is probably the most infamous disease. It was called mad cow disease. And there are also prion diseases of humans. So this is another group of diseases that we are concerned about, okay, in terms of transmission between different populations of wild deer and deer herds that are being farmed. Okay. Another one is Hantavirus. Hantavirus is a pulmonary syndrome that's potentially fatal in humans, and that's transmitted by rodents. So humans get hantavirus when they're exposed to urine or feces or droppings or saliva. And it's commonly seen that if a family is cleaning out an old farmhouse or cleaning out an old barn and it's dusty and they're not wearing face masks, that they can come into contact with hantavirus, and it can be potentially fatal. And we do see fatal cases of hantavirus every year in the United States. So another thing, an unusual virus that we do need to keep an eye on. Nipah virus, considered another unusual exotic disease that is spread from bats, and it's mostly seen in Southeast Asia. But we are concerned about Nipah virus. Australia here in the Northern Territory, right here above Darwin, very concerned with spread of Nipah virus from bats to humans. Marburg, the next two, Marburg and Ebola virus or hemorrhagic fever viruses. Marburg virus has been associated again with contact with bats in caves in Africa. So tourists or local people who have been exposed to bats in specific caves have been exposed to Marburg virus and the fatal hemorrhagic fever virus. Very unusual, and you can see the news headlines, deadly Marburg virus. It is fatal. And it is in the same group as Ebola virus. Of course, Ebola has had a lot of media attention in the last few years due to the really increased numbers that we saw in Africa and due to the spread of Ebola from Africa to other continents, and we saw Ebola in this country. And this really tells us how easy it is for a virus to spread and a disease to spread from the country of origin into a different country where we do not usually see this virus or this disease, and then how does that particular state or country deal with a virus? How are we going to deal with a highly infectious pathogen? So Ebola virus is a very good example of what would we do or how are we going to cope with this new pathogen in the United States where we haven't seen it before. Yellow fever, we have seen changing in Brazil, okay? Some of you may remember this from the Olympics. Zika kind of overshadowed the disease concerns of the Olympics, but yellow fever is another one that we're concerned about. Brazil actually has released an update in their exposure for yellow fever for people visiting Brazil because the range of yellow fever has spread out. So this was the current exposure, but it has spread out to include these Atlantic coastal regions. So we have seen yellow fever spreading. We've also seen yellow fever in the past in the United States. And yellow fever is a great example. It's a vector-borne disease spread by mosquitoes. It's a great example of a disease that will spread because the mosquito spreads. So if the mosquito spreads, the disease spreads with it. So we have seen yellow fever in this country before. And hopefully we will not see it again, but that will depend on vector spread. Okay, so that transmission continues to expand towards the Atlantic coast of Brazil that were not deemed to be at prior risk in the last release for yellow fever from the Brazilian government. Another concern is MERS. This is Middle East Respiratory Syndrome, and this is caused by a virus, a coronavirus, and is most commonly seen in Saudi Arabia, but also in Qatar in the Middle East, and humans come in contact with this from camels. So it's transmitted from camels to humans, and it causes a pulmonary respiratory syndrome that is fatal in humans. And we have seen this year 2 major reports of diseases, one in Qatar, where there was one individual who developed symptoms in March, and this patient, and this was concerning, this patient had not reported any history of contact with camels or individuals with symptoms and had no travel outside of Qatar. So this individual case, okay, it's one case of MERS, doesn't seem like a major incident, but what is going on? We've got a person who has no report of contact with camels. He said he didn't travel outside the country. None of his friends or relatives reported having MERS, so now the government of Qatar has to try and figure out where this is coming from. Because in this part of the world, camels are a major source of business and revenue, so it's really important to their government to figure out what's going on. In Saudi Arabia, for the first 3 months of this year, the last report, they reported their data up to March 16th, there have been 56 cases of MERS, including 21 fatal cases in humans. So again, this is very concerning to the government in Saudi Arabia. How is this being transmitted? What is happening with the camel population? What are we going to do to try and prevent this transmission? So this is a serious situation with quite a serious virus. And then a couple of more tick-borne diseases. We're always concerned with the tick-borne diseases. Of course, in Kansas, we have the famous Bourbon virus. We don't like to be famous for a new organism, but this was discovered in a man in Kansas, and he did die from Bourbon virus, and this was transmitted by a tick. So this is a new tick-borne disease discovered here. We should always, of course, be concerned with ticks because they do carry a lot of pathogens that are very serious in both illness and fatality for humans. Lyme disease, Ehrlichia, Rocky Mountain spotted fever, all of which can be found in the state of Kansas. And then arboviruses, we have got a large group of arboviruses transmitted by mosquitoes that have a very large cycle with multiple potential hosts. Humans, of course, the vector species could be mosquito or ticks, birds, and then other animals, and they have this very large complicated life cycle where they can transmit between the different potential reservoirs. So we're always concerned about arboviruses. And then a couple more fungal viruses, or excuse me, fungal diseases. So fungi are eukaryotic organisms, which makes them different to bacteria. Their cell structure is the same as ours. We're also eukaryotic. So fungi are eukaryotic organisms, and we definitely see emerging opportunistic fungi, particularly when we see habitats that are interrupted. So when humans encroach territory that has not been inhabited before, either by humans or agriculture or animals that are used for agriculture, we do see exposure of animals and humans to fungi that have not previously been a problem. And we see this continually, particularly in South America, where large tracts of lands are interrupted and encroached upon for human use. So fungal diseases continue to be something that we need to be aware of. And then lastly, our current concern, Zika virus, which is transmitted by mosquitoes. And it's certainly not a new virus, but it really exploded upon the scene, particularly with the Olympics being in Brazil. And we see a large increase in number of Zika cases. And then, of course, the complication with a large number of pregnant women being infected with Zika, and then their babies having microencephaly. So they were born with microencephaly. So an added concern, a virus that has spread from Asia to South and Central America, and now is showing different signs and symptoms for pregnant women and then having an effect on their babies. So something new coming from a disease that we may have recognized before. So all serious concerns. So you might gather now that I like infectious diseases, and this is really how I got into public health. I could have talked about anything to start out by public health. I could have chosen diet, I could have chosen lifestyle, I could have chosen blood pressure, I could have chosen environmental health, but really I entered public health because I'm interested in infectious diseases. So that is where I started. I, like many science people, found that I really liked science in school. Okay, I loved all my science classes, I adored all my science teachers, and I knew that that's what I wanted to do. Okay, this is me in primary school and elementary school right there. And this is me as a teenager, awesome clothes and awesome hairstyles. And this is actually, of course, in the 80s. And this is actually a photograph I took in one of my high school chemistry classes. I'm amazed I still have it. We did a very simple experiment. That was a catalase experiment, looking at the reaction of catalase in a test tube. And this is my high school logo there, Sullivan's Light. And right here I've got National Geographic and a mosquito. So how did I decide that I wanted to be a person who studies infectious diseases? When I was 14, we used to get National Geographic every month, and of course back then it wasn't online, it was just a magazine, so it came once a month. I read it from cover to cover and I loved it. And when I was 14, one of the editions that came that year was on mosquitoes, and on the front of it, it said malaria hunters, and I thought this was the coolest thing ever. I had never thought before about being a person like this. So I decided this is what I wanted to do. So I went and talked to my biology teacher and my chemistry teacher and my physics teacher and tried to figure out where I would start. Okay, so that would bring me to microbiology. So my undergraduate degree was a bachelor's in microbiology. Okay. And I did that at University College Cork in Ireland, which has a big microbiology department. Their microbiology mostly focuses on dairy and food and animal agriculture microbiology, which was not what I was interested in, but it was the biggest microbiology department in the country, so that's where I did my undergraduate. And I really liked microbiology. I just loved everything about it. In my final year of microbiology, I took a course, Infectious Diseases 2, so it was the second in a row, and our professor was on the European Union Advisory Board for Prion Diseases, because at that time in Europe, Prion diseases were a major deal for mad cow disease in Britain. And he used to come back from his various meetings and tell us all about what happened at these advisory panel meetings. So I thought this was super cool. This is definitely what I wanted to do. So I looked around to find out where in the world could I do some more work on prion diseases. And at that time, there were a few choices. There were a couple of labs in universities in Britain. I decided that was too close for me. There was a lab in Australia. I decided that was too far. There were a couple of labs in Europe, in other European countries, one in Italy, one in Geneva. I didn't speak Italian, and my French was definitely not good enough to do a PhD in French. So I looked in the United States and Canada, and at the time, there was a professor at Creighton University working on Prion diseases. So I applied to Creighton to go to graduate school, and I was accepted, and I went to work in the Prion lab. So I spent 4 years working on prions, and I really enjoyed it, and I learned a lot about protein research, cell culture research. How do you figure out what a disease is? If it's a new disease, what are you going to do? How are you going to figure out symptoms? How do you figure out incubation periods? What would you have to do in order to figure out a new disease? And I use the word new there because at that time, prions were still considered new, right? We didn't have a lot of information like we do today. After that, I did 2 postdoctoral fellowships. So if you do a PhD in infectious diseases or any scientific area, a common next step is to do a fellowship, so further study and research. So I did one in Prion diseases, and then I did a second one in HIV, human immunodeficiency virus. And for the second one, I still stayed in the brain, so I looked at how HIV crosses the blood-brain barrier and the neurological effects of the virus in the brain and brain cells. And while I was doing my second postdoc in HIV, I decided to do an MPH, a master's in public health. And my thought was, I will do a master's in public health, I'll learn some more epidemiology, I'll take some more statistics classes, and it will really help me out, okay? And I found that I really enjoyed public health, and I became very interested in population health, strategies for population health, how do we educate and promote health in the population. So I really saw how public health fits into prevention of infectious diseases. So that's how I took a long, windy road to a career in public health. You don't have to take that long to get to a career in public health, but that is the one I chose. It looks like I kind of did a 180. I did a PhD first, and then I went back to do an MPH. But a master's in public health can be both a standalone degree and can be something that you add to a graduate degree you already have. So it works both ways. So the next few minutes I'm going to talk about how would a person today enter a career in public health. Okay, so I did my MPH in the 90s. Okay, so how would you do that today? All right, you don't have to do the long-winded approach that I did. We've got some more options for you. So at K-State, there's a few options, okay? You've got 4 areas to choose from: food safety and biosecurity, infectious diseases and zoonosis, which is what I spent the first 20 minutes talking about, public health nutrition, and public health physical activity. So there are 4 different areas of public health that you can focus on. And different universities in the country focus on different areas. We have 4 at K-State that we focus on, okay? So the first way you can enter a career in public health at K-State is you can do a 5-year combined master's with your bachelor's degree. So you can do 5 years and get your bachelor's and master's in public health. So you combine them together. So we consider this a concurrent degree. So essentially you would get a bachelor's of science, and then you would add your master's of public health, and when you combine them together, you can do that in a shorter time span than if you were to do one and then stop and then continue on with your master's. Most students apply during the end of the junior year or early in the senior year. And these are our most common majors that undergraduate students are in when they apply to the MPH program in their junior or senior year. So animal sciences and industry, food science and industry, biochemistry, dietetics, kinesiology, life sciences or biology, microbiology. We have had several athletic training, and then they go into public health physical activity, nutritional science, psychology. So those would be the most common areas. So students have their undergraduate degree with this major, and then they continue on to do their master's. So they can save some time by pursuing them together. The next way you can do it would be the more traditional graduate school route. So you complete your undergraduate degree and then you apply for graduate school. So that would be the traditional route that most people go to graduate school. And if you did it this way, you would do 2 years in graduate school. So you would complete your master's in public health in 2 years. if you also took summer classes, you could complete it a little faster in under 2 years. So we do 5 core courses, what we consider the main competencies of public health. So we do a biostatistics class, an environmental class, epidemiology class, administration of healthcare organizations. The first 3 are pretty self-explanatory. This 4th one here, this is how does our healthcare system work. That class explains how the healthcare system works in the United States and some comparisons to other countries, but mostly how does it work here, okay? And then social and behavioral basis of public health. This talks about cultural competency, health equity, health disparity. So how are different vulnerable populations in the United States in terms of their healthcare access? So students take 5 core courses, and then they take their remaining courses, 20 hours, so that's about 6 or 7 more courses in their area of emphasis. So if you decide you really like nutrition, you would take your remaining courses in public health nutrition. If you decide you really like infectious diseases, veterinary science, animal science, you would take it in infectious diseases. If you're interested in food safety, biosecurity, food science, that would be the food safety, biosecurity, and then the 4th one would be the physical activity. So, and then all students do a field experience, and this is where all public health students go and spend 6 weeks full-time with a public health agency. And this is really where students can figure out what my job is going to be like in public health, okay? Am I going to work for the health department, either a local health department in one of the counties in Kansas, or one of the larger public health agencies like that could be a federal agency, a large public health department like Johnson County Health Department is a large public health department, or Kansas City, Missouri is a large public health department. Or you could, a lot of students also work in Topeka with the state public health agency. And this is where students really figure out, what is my career in public health going to be like? What am I going to do day to day? What does a person with a master's in public health actually do? Okay, so students work on an actual project, but also spend time in that agency figuring out what their job is going to be like, right? And then the 3rd option is we also have a concurrent DVM MPH. So if you're a student in veterinary school or you're interested in being a vet, we do have a concurrent program that you can complete your MPH while completing your DVM degree. So you can work on both at the same time, and then when you graduate with your veterinary degree, you also graduate with your master's in public health. So they can be pursued at the same time. You can save some coursework because you can use 12 credits, which is essentially 3 to 4 classes for both degrees. So it does save you some coursework. And the program is offered a mix of online and in-person. So a lot of veterinary students do take courses online, which helps with their DVM curriculum and their schedule, or they take them in the summer, so they kind of mix it that way. Some students also choose to finish up afterwards. So we have a DVM student who completed her DVM degree last year, for example, and she just completed her MPH. So she decided to stay 1 more year and work in the area and complete her degree. So she worked for the Kansas Department of Agriculture, which is located in Manhattan. And so that's another way of doing it, and then completed her MPH. Okay. So those are the different ways that you could approach how would I decide to get into public health at K-State. So a few different options, okay? So I'm going to spend the remaining few minutes talking about those other areas. So I spent a lot of time on infectious diseases because clearly that's what my background and my area of interest. I'm going to talk about the 3 other areas that we have. So the first one of those is food safety biosecurity. And this really looks at food science, food microbiology, how are we going to protect the human and the animal food chain. And then how are we going to make sure that it's safe for human consumption, for animal consumption, etc. All right. So why food safety? Foodborne disease is extremely important. I cannot emphasize this enough. It has a major impact on human health. The CDC estimates that approximately 1 in 6 Americans get sick every year from a foodborne disease. Almost 130,000 people are hospitalized, and approximately 3,000 people die from foodborne disease. These numbers that the CDC estimates are extremely conservative. They're probably grossly underreported because most people, when they get sick from a foodborne illness, don't go to the doctor, okay? Most people just stick it out and it'll be over in 24 hours. I feel terrible now, but I'll be better tomorrow. Most people do not go to the doctor with a foodborne illness unless something else happens. They have a more serious symptom. It doesn't go away in 12 to 24 hours, or they know because someone else has been ill that it's something they need to go to the doctor for. So when we are trying to estimate numbers of foodborne illness, it's very difficult. So the focus for the USDA, the United States Department of Agriculture, is trying to prevent and trying to reduce the illness. So how do we try to prevent foodborne illness? How do we instill food safety principles? How do we really think about prevention? How do we promote safety, sanitation, disinfection, hand washing, number one prevention, okay? Hand washing. So that's really the USDA's focus in terms of food safety at each step of the production, from the animal or the plant source at the farm all the way to when a person consumes it at home or in a restaurant. So literally farm to fork. I'm sure you've heard that before, okay? Careers in food safety. So where do students with public health degrees who are interested in food safety go? Okay, so they could be interested in looking at food safety compliance, so large industrial, agriculture, food services, food production would have directors of food safety and food compliance, and they would have graduate degrees in this area. Food inspectors, so each one of those large facilities that produces food, whether it's animal-based or plant-based, they would have to be inspected by the USDA, okay? So a person would go in and inspect their facilities. Sanitation specialists would be another one. Lab analysts, an example of that would be the FDA, the Food and Drug Administration. They have a large lab here in the Kansas City area in Lenexa that does food testing. So they test food for very common environmental toxins and pollutants. They collect food from all over the country and they test them right here in Kansas City. So that would be a very interesting and very important job looking at our food safety. Supervisory or veterinary medical officers. We do have some DVMs who choose to do their MPH in food safety. So the majority do them in infectious diseases, but a small subset do work in food safety because they're interested in food animal or protection of the food supply. And then food safety manager and a food technologist would be some other career options for food safety. So infectious disease and zoonosis, I think I definitely covered that, but I did want to list out a few career possibilities. The obvious: veterinarian, veterinary assistant, veterinary technologist, or technology assistant. So those would be the more common careers that we would think about. But some other ones, lab technologists, directors of health or associate directors of health, particularly in the areas of emerging diseases or sexually transmitted diseases like HIV, syphilis, chlamydia. Any large agency such as a hospital, a medical supply, any type of company that is going to design, develop, research drugs, medication, therapies will have several staff members who would understand public health and infectious disease. Epidemiologist, so someone who really looks and tracks and is focused on surveillance of disease. And then people working with ministries of health across the country or across the world in terms of health departments at the local level, the state level, the federal level. Okay. The next one, public health nutrition, would be the third emphasis area. This focuses on promotion of good health through nutrition. So really looking at prevention of nutrition-related illness such as diabetes, obesity, metabolic syndromes, how we can really look at our overall health and nutrition in terms of prevention by ensuring that we have access to food, access to healthy food, and education and awareness about what actual good nutrition is, okay? We see this is really important in terms of large production facilities and large provision of food. So think about school lunch programs, think about hospital food, think about really large hotels, okay, so areas where large amounts of food
are served several times a day, 24/7, okay? So that's really important in terms of nutritious food. So also it would be important when we're talking about nutritional related public health in terms of global problems, food security, food access, in terms of poverty. So really looking at how we have access to food, and not just access to food, any food, access to nutritious food, right? So chronic diseases in the United States account for approximately 70% of mortality in the United States and really contribute to major limitations for daily living. And the chronic diseases that I'm talking about here would be heart disease, so cardiovascular disease, cancer, diabetes, and a contributing major factor here would be obesity and lack of physical activity. So when we talk about public health, we're concerned with, yes, what is the #1 cause of disease in the United States? It's heart disease. But what are the important contributing factors? That would be obesity, nutritional issues, and lack of physical activity. So what is the cause, but what is the major comorbidity or contributing factor? And more often, the contributing factor is more difficult to approach. Obesity, very difficult to approach because we have it's a multifactorial issue, okay? So these diseases are related to health risk behaviors. Yes, they're modifiable theoretically, but they're difficult to approach on a population level. So poor nutrition, lack of physical activity, environmental factors. Yes, in theory, these are modifiable, but it takes really large-scale structural change to be able to tackle those large problems, okay? So some careers in public health nutrition. Some of the more obvious ones would be a nutritionist or a dietitian, but then some other ones would be extension agents. So extension agents are in every county in Kansas, and the majority of them would have expertise in nutrition or physical activity, family, and consumer health. So several MPH students are extension agents. Several extension agents in Kansas have public health degrees, so you see it in both ways. And that is a great way of promoting public health across the state. And then lastly, public health physical activity. When we're thinking about physical activity, of course, it's extremely important for exercise, for heart disease, for maintaining really all sorts of healthy physical activity. But when we think about public health physical activity, we're not just targeting one person trying to get them to go for a walk every day. We're targeting a whole town. Let's make sure that everyone has a well-lit, built environment to go for a walk. Or let's make sure that every elementary school has a safe walk to school, not just one or two of the elementary schools. Or that every elementary school or middle school has safe equipment in the playground so every child in town can go out and run around at their break time, not just maybe half of the schools. So we're talking about large-scale population strategies to ensure access for everybody to physical activity, okay? So really encouraging populations of people to be physically active and have access to a safe built environment, okay? Physical inactivity has been identified as the 4th leading risk factor for mortality. And again, this is the contributing factor, okay? So we're contributing to the problem of obesity and cardiovascular disease. And of course, we all know that regular, moderate, intense physical activity has significant benefits for health by decreasing risk of cardiovascular disease as the primary benefit. But it comes from helping control weight, maintaining healthy large bones as well as supporting bones. But again, when we think about public health physical activity, we're really focusing on the population by going one person at a time. So careers in public health physical activity. So here are some examples: physical activity directors, rehabilitation specialists, different type of trainers or athletic trainers, teachers. Our students in physical activity at K-State in public health really do fit into all of these. We've also had students who are extension agents, who work at large companies who have their own health and wellness programs in the company, who work at large insurance companies to promote health and wellness for their employees. So our physical activity students have really found a lot of varied careers using their public health degree. Okay, and lastly, some environmental health. We, at K-State, we do not have a master's in environmental health, public health. However, several students are interested in environmental health, and we do offer several courses in toxicology. So if you are interested in environmental health as part of public health, we have several course options available to be able to take the coursework, and then we do find a field experience for a student who's interested in environmental health. So this is an area of public health that is extremely important, environmental science and environmental health. So we do have several students interested in this area, so we make sure that we try and match the courses and their experience, even though their degree usually would be in food safety, but we put it together for them, and it works pretty well. Okay. All right, so here's a list of sample field experiences, and then I'm going to finish up. So we've had a lot of really interesting field experiences for our students. We have had students who work for the USDA, so the United States Department of Agriculture. We have had students who go work for the armed forces, for their public health commands at various posts around the country. We have several students who have worked at different health departments around the country. New Mexico is one example, several in Kansas, North Carolina, California, New York. So we've had several students go work in different health departments around the country. Extension offices, Riley County, of course, is where K-State is in Manhattan. We've had a lot of students work right here in Olathe at the Johnson County Health Department. Several students work there. Kansas Department of Health and the Environment, which is in Topeka. We have several students who do their field experience there, and with the Kansas Department of Agriculture, which is located in Manhattan. So another state agency, which is really important in terms of public health. And we have several students who also go do their field experience outside the United States, to Central and South America, Europe, China, Africa, Asia, Mongolia is just listed there as an example. We've had several students who really are interested in that international experience, so we find a place for them to go work in another country. All right, so with that, I'm going to finish up. So I hope that I've piqued your interest in public health. And from personal experience, it is definitely a very interesting both academic and practical career. And we have time for a few questions. So if anyone has questions here or on the phone or on Zoom, whichever camera I'm supposed to use. This one, okay. I think we have 2 or 3 minutes for questions.
So you did mention rabies. Is rabies still a problem in the United States?
Yes, it is. I didn't mention rabies, but yeah, it's hard to mention all the diseases. Yes, rabies is still a problem in the United States. And I think we have one benefit in terms of rabies here because we have a really great surveillance network for rabies in Kansas and in the United States. So we do track rabies carefully. When we look at rabies worldwide, countries are separated into various stages of being rabies-free. So a country can be rabies-free or be rabies-free by vaccination and eradication or not be rabies-free, so be rabies endemic. So it's really important when thinking about global rabies that you look at countries that do have rabies, that have vaccination programs for rabies, and also that are rabies-free. So different countries will have very tight import-export policies because they might be rabies-free, for example. But rabies is definitely still a major disease for both humans and animals. In the United States, we vaccinate very carefully for rabies.
We have a question remotely if you have a chance.
Sure.
You ready for us?
Yes, we're ready.
Okay, so one of our questions was, can you tell us a little bit more about mass wasting disease? What is it?
Chronic wasting disease?
Yes, thank you.
Okay, so chronic wasting disease is a prion disease, and it's found in deer and elk in the United States and in Canada. And it's transmitted through direct contact. So deer can acquire chronic wasting disease from contact with other deer and elk, but also from in the environment. And it's caused by an infectious protein called the prion protein. So PRP is essentially an amyloid protein. So most of us would be familiar with an amyloid protein causing Alzheimer's disease in humans. So PRP is an amyloid protein, and it becomes insoluble and sticky, and it causes these aggregates in the brain, and they turn into fibrils, which are long, twisty forms of protein, and that builds up in the brain and becomes neurotoxic. And it causes neuronal death and neuronal dropout. So the brain takes on what's called a spongiform appearance upon pathological investigation. So there literally is a decrease in brain matter because there's toxicity, because there's neuronal toxicity. So it's of concern for deer and elk in the United States and Canada because it causes this wasting disease and ultimately is fatal. There is no known transmission, I'll be very clear, there is no known transmission of prion diseases between deer and humans. So however, there is established transmission of prions between cattle and humans, and that occurred in Europe in the 1990s from bovine spongiform encephalopathy, where humans consumed meat of animals that were sick with BSC. But for CWD, chronic wasting disease, there is no known link. But it's very important in terms of raising deer and trying to maintain a herd of deer that is CWD free if there are wild deer in the area that are CWD positive. And that's a big concern in this country and in Canada.
Cool, thank you so much.
You're welcome.
So I know that you mentioned that there wasn't like a specific path for environmental health in terms of public health?
Not at K-State.
Yeah, not at K-State, but like, is there a concurrent degree for like green technology in like in association with public health and like conservation work and
so conservation biology,
yeah, like protecting our water supply, protecting our air, you know, our coastlines, all this, and animals as well in danger.
Right. So, so you can. So other universities do offer a master's in public health with an environmental health focus, but not in Kansas. So not at either of the schools in Kansas that offer an MPH. Some other schools in other states do offer an environmental health focus. So if that's an area of interest, you could do your master's in public health, and the emphasis area, so we talked about before at K-State, your emphasis area then would be in environmental health or toxicology. And then you would approach it from that way. Or you would combine epidemiology and toxicology if you were interested in something like water or environmental pollution, pollutants, air supply, etc. Yeah. So that would be a really interesting area of public health and very important in terms of population health, particularly what we saw with lead poisoning in Flint, Michigan recently. We still have issues with asbestos poisoning and continually issues with air quality. Any other questions? Nope.
No. So thanks again for coming. I know with rescheduling of spring sports and stuff, it's really hard to get here. So thank you for taking the effort. Hope to see you again.